Today we're going to be talking about formulating the focused clinical questions. We're Group Unicorn. So in the evidence-based cycle, we have these steps: ask, acquire, appraise, apply, evaluate, and assess. We're going to be focusing on the ask and acquire part. So here's our patient scenario. Mid-July, Lily Smith, a 6-year-old girl, comes into the office because of pain on her left mandibular side, possibly a cavity. Lily only comes to the office every 6 months for her normal checkup. Her mother says Lily eats relatively healthy with the occasional unhealthy candy bars. At this appointment, the dentist noticed that her 6-year molars have just erupted. The mother is concerned for her other teeth and wants to make sure she doesn't get any more cavities. She uses non-fluoride toothpaste and asks for your recommendation concerning fluoride toothpastes preventing cavities in the future. So the advantages of using PICO with this information: we have a concise form of finding the information. It provides simple search terms that are easily identifiable. Ultimately, it will help form a strong and good research question. So correlation to formulating a clinical question: how would I describe a group of patients similar to mine?
So the P in PICO stands for population. It can represent one of two things: the patient's problem and the population. There are some important factors that must be considered, such as the chief complaint, the primary problem at hand, the current health state, race, age, sex, and other previous health concerns. So the population in our patient scenario would be a 6-year-old girl who comes into the office every 6 months for her normal checkup and who eats relatively healthy. If we were going to search this in PubMed or one of the library databases, we would search a young, healthy child with newly erupted teeth.
The I in PICO is the intervention is the main treatment in consideration. In our scenario, fluoride toothpaste is the intervention.
The C in PICO stands for comparison. So what we're asking is, what is the main alternative to the intervention? This can be a different type of treatment, a standard treatment, or no treatment at all, like a placebo. So going back to the patient scenario, the comparison in our patient scenario is the non-fluoride toothpaste. We would use this search term to look up in PubMed.
Outcome, the O of PICO. Outcome is the final consideration of a PICO question and define the results. It deals with what was accomplished, improved, or changed, and it should be measurable. The most specific outcomes will bring better results to find studies that focus on the particular outcomes. Does using fluoride toothpaste prevent cavities? Does using fluoride toothpaste decrease the chance of getting cavities? Does using fluoride toothpaste improve the overall health of patients with a poor diet? In our patient scenario, the outcome would be preventing cavities in the future. Outcome, increased improvement of dental health and decreasing cavities.
So in the end, with these PICO, we find that our focused clinical question is: in a young, healthy child with newly erupted teeth, will fluoride toothpaste or non-fluoride toothpaste be more effective in decreasing the chance of getting dental cavities and improve her dental health? So using these, we would go into these search databases: PubMed, HubNet, UB Libraries, or Google Scholar. Using these keywords, we can find exactly what we're looking for. And here are our citations.